Hello, my name is Damon McCaskill and welcome to my lower extremity analysis. I pulled both my hamstrings playing rugby. A pulled hamstring is a muscle strain, which is a tearing of the muscle. Essentially, I'm asking my muscle to contract and relax simultaneously, causing a pull on my bicep femoris. I know what my problem is. However, I want to dive deeper and analyze any other muscle imbalances I may have. The static posture assessment is important because it identifies any muscle imbalances from a standing posture position. Anteriorly, my right foot externally rotates, which suggests that my right lateral gastrocnemius and my short head bicep femoris are overactive or tight. And it suggests that my glute medius and my glute maximus and my vastus medialis are lengthened or underactive. There were no significant findings in the lateral view. Posteriorly, my right hip hikes, which suggests that my right TFL and my bicep femoris are tight, and my glute medius is suggested to be weak or underactive. The overhead squat test assesses flexibility, balance, and overall neuromuscular control. You want to have your clients stand shoulder width apart and have them raise their hands overhead with elbows fully extended. Have your client squat to chair height and return to the starting position. Repeat the movement 5 times. Anteriorly, I have slight varus, which means my knees move outward, and it suggests that my bicep femoris and TFL are overactive and my gluteus maximus is underactive. Laterally, I have excessive forward lean, which suggests that my gastrocnemius and hip flexors are overactive and my anterior tibialis and gluteus maximus are underactive. Posteriorly, my foot flattens and I have a slight heel raise. It suggests that my lateral gastrocnemius, soleus, bicep femoris, and TFL are overactive, while my gluteus medius and my anterior tibialis are underactive. Next are the range of motion assessments, which are to determine the amount of motion available at a specific joint. First is the hip flexion assessment, which assesses the gluteus maximus. The center of the goniometer should be at the lateral thigh. The stationary arm should be at the lateral midline of the pelvis and mid-auxiliary line of the trunk, and the moving arm should be at the lateral midline of the femur. Instruct the person to flex their hip until discomfort or stoppage. Next, we have the hip internal rotation. We want to assess the piriformis, gluteus medius, and maximus. The center of the goniometer should be at the anterior aspect of the patella. The stationary arm should be parallel to an imaginary line down the center of the body. And the moving arm should be at the anterior midline of the lower leg. The goal is to turn the foot externally so the hip goes internally. Next, we have the hip external rotation, which the goal is to turn the foot internally so the hip goes externally. We want the center of the goniometer to be at the anterior aspect of the patella, the stationary arm to be parallel to an imaginary line down the center of the body, and we want the moving arm to be at the anterior midline of the lower leg. Next, we have the hip extension, which assesses the psoas, iliacus, and the TFL. The center of the goniometer should be at the greater trochanter. The stationary arm should be at the lateral midline of the trunk, and the moving arm should be at the lateral midline of the femur. Last, we have the hip abduction assessment, which assesses the adductor complex. The center of the goniometer should be at the anterior superior iliac spine, or ASIS. The stationary arm should be on an imaginary line connecting to an ASIS to another ASIS, and the moving arm should be at the anterior midline of the femur. Muscle strength assessments are used to add resistance to a specific muscle and assess the client's strength. First, we have the bicep femoris assessment. The client lays in a prone position with knee flex 50 to 70 degrees. Slightly externally rotate the thigh and tibia. Look for compensations of hip abduction, hip flexion, and ankle dorsiflexion. Next, we have the medial hamstrings assessment. Client lays in a prone position with knee flex 50 to 70 degrees. Slightly internally rotate the thigh and tibia. Next, we have the gluteus maximus assessment. Client is prone with hip in extension and knee flex. Place thigh in external rotation and abduction. Look for compensations of knee flexion or hip internal rotation. Lastly, we have the gluteus medius assessment. Client is in the side laying position with hip slightly extended and knee extended. Place thigh in external rotation and abduction. Look for compensations of knee flexion, hip flexion, and hip internal rotation. Looking at my results, I see that my range of motion assessments are less than the normal degree of motion. It's important to pay close attention to the hip extension range of motion assessment and the gluteus medius and maximal muscle strength test. My gluteus medius maximus strength tests were graded as a 2 due to compensation of my bicep femoris and lateral gastrocnemius. Looking at this picture from my hip extension range of motion test, my hip does not extend. Gluteus maximus is in charge of hip extension, which indicates some weaknesses. In conclusion, my overactive or tight muscles are my bicep femoris, lateral gastrocnemius, and TFL. My underactive muscle is my gluteus maximus. Solving my identified neuromusculoskeletal problem will require a plan known as the corrective exercise continuum that allows me to identify the problem, solve the problem, and implement the solution. The 4 steps of the corrective exercise continuum include the inhibitory phase, the lengthening phase, the activation phase, and the integration phase. The inhibitory phase involves self-myofascial release, which releases tension in a specific muscle area. It's almost like rolling out pizza dough. I chose to foam roll my overactive muscles, bicep femoris, lateral gastrocnemius, which require me to externally rotate my foot, and TFL to release any tightness in those specific areas. Next, the lengthening phase involves stretching those overactive muscles indicated. I perform the bicep femoris stretch, where I place my foot on the desk, externally rotate, and sink my hips with my back flat. Then I perform the gastrocnemius stretch, where I place my hands on the wall, with one knee bent and the other straight with my foot flat on the ground. I push my hips into the wall with my back leg straight and my foot continuing to be flat. Then I perform the TFO stretch, which requires me to get on one knee, and I will take my opposite arm and extend my internal external obliques over that bent knee. Then the activation phase is the phase where I target my underactive muscle, which is my gluteus maximus. I decided to perform glute bridges to practice hip extension, where I lay supine with my hands and feet flat and extend for a full range of motion. I progressed the glute bridge from the floor onto a ball to practice stability while performing hip extension. Lastly, I progressed again from the ball to a barbell to add weight for necessary muscle strength and growth. The integration phase is where I bring it all together. It's a combination of overactive and underactive muscles to perform a specific exercise. The integration phase usually consists of multi-joint exercises. First, I perform Bulgarian split squats for quadricep and glute maximus strength. I rest my back foot on the bench while my front leg is about 5 to 7 inches away from the bench, and I perform the squat with dumbbells in both my hands. Then I perform goblet squats to add strength for my glutes and quadriceps. Stand shoulder width apart, keep back flat, flex knees and hips to your lowest point, and extend upward while holding a dumbbell in your hand. So why is this important? It's important to take care of our bodies. We may be used to an incorrect movement that can cause major injuries, and besides, knowledge is power, and so is being strong. Thanks for watching. I hope you enjoyed this video. See you next time.